from the station that's on your side. This is Channel 7 News Daybreak.
Well, it's happened to many of you. You're taking advantage of the nice weather. You've increased your runs, and now you have that ache in the back of your leg just above the heel. You're not alone, folks. Baptist Health Dr. Devon Ballard with Sherwood Family Medical Center is here to help you with the diagnosis and how to get you pain-free. Dr. Ballard, thanks for joining us. I know that you've been out the baseball fields getting things ready. You've been seeing a whole bunch of kids run around, adults running around. Everybody is enjoying the outdoors these days, which is typical. But with that can come with some aches and pains, specifically, as we mentioned, the Achilles area. And that is something that I know that you guys see more frequently in the summertime.
Correct. Usually, so the Achilles tendon is in the back of the heel, so everybody can feel that cord going down. If you go down from your calf all the way to the heel bone, it connects, and so it's a pretty strong tendon. But you'll see quite a few injuries, usually can be adults or kids, with doing explosive type maneuvers. Okay. Sprinting to first base, playing tennis, going for the drop shot, a basketball player going for a rebound, or typically runners. Especially if you're just starting a running program or if you're training to do the marathon, you'll have that pain and kind of sometimes even a lump in the back of the heel area.
Really? So does it lump up enough to where it's visible? It's noticeable?
So people have always heard of Achilles tendonitis.
Sure, yeah.
There's also, if you chronically irritate the tendon and cause tendonitis, it causes tendinosis, which is actually a calcification of the distal tendon, which makes it turn into bone. So you'll see in the back, chronic runners will have a lump area, and that's actually the tendon that has turned to bone at times.
Wow, okay. Yeah, so that's more of an extreme case, but it can happen. We have a lot of runners here in Arkansas, a lot of people who go out and do that, so certainly is something that they have to watch for. But what are some of the ways to treat it? What are some of the things to do to make it, I guess, a little less painful?
Come see one of us, because Achilles tendonitis can chronically linger for months. So when you first feel that pain in the back of the heel, always get looked at to make sure it's just a strain or a tendonitis, and we'll show people how to you ice it, take an inflammatory at home, like take 2 Aleve twice daily or ibuprofen before you see us, and you really have to stretch it. Really? You have to do a stretching regimen and program and decrease the tension on it. So that activity of running, basketball, has to stop immediately until you recover the tendon, and then you can gradually increase that activity back to normal over probably a few weeks. But if you chronically, repetitively keep re-injuring it, it can linger for a while, and you'll be limping and can't wear your heels and can't do
can't
things
go play sports,
can't go play sports and all that kind of stuff.
Okay, so do not continue to play on it. If you feel that pain, go call the folks over there at Baptist Health. You can always call Dr. Ballard's office, of course, at the Sherwood Family Medical Center, or go to the Baptist Health website and call that number on your screen, 1-888-BAPTIST. Dr. Ballard, great to see you.
Thank you.
All right, take care. We'll see you next time.